Dr. Gregory Johnson, and today we're going to be going on how do you treat asthma, allergies, and sinus problems, which are really prevalent in this time frame of the year, the spring, especially here in Houston and Austin and all these areas. So what I'm going to show you today is what I do to help patients that have severe sinus problems, allergies, and asthma. So we're going to go ahead and decompress her first on the y-axis. This will first and foremost separate all of the joints from her occiput all the way down to her sacrum of the pelvis. I want to bring her legs to where they're parallel with the floor there. And the sinuses are supplied out of the C2, C3 area of the cervical spine, as well as the occiput atlas. Yes, look at that. There you go. Good. Okay. There we go. Now, I want to make sure that the patient has their jaw closed and their tongue's not in between there. And just breathe normal for me and I'll catch you. Excellent. Very nice. See, that was a nice smooth pull. And you felt that all the way down, didn't you? Very good. Now, while she's in this position on her back, I'm going to adjust C2 right here on the right. As you can feel that, I can feel that's out. Okay. Perfect. Good job. You probably heard that all the way over there. Excellent. Now, here's how we're going to treat the sinuses. Right down here, we have the zygomatic processes here. So we're going to go right underneath those. Take a breath through your nose. And I'm applying some deep, steady pressure. Very painful, actually. Now see that? She's really fulled up right there. Yeah. Patients usually only tell you about this one time. So you usually get one chance to fix them on this one. Do that 3 times. Now I'm going to move up to her ethmoids right here. Okay, take a deep breath in. And sphenoid sinuses. You just put a pressure on them. Again. Now I'm putting a steady, slow, but deeper pressure in as they inhale. Another one. Very good. A lot of times you can even feel it kind of cracking and popping in there. Now we're going to do her frontals. Take a deep breath through your nose. And I start right there and go right along the eyebrows. As you can see, those are very painful because they're full. Deep breath in. And then just let it out. Yeah, everybody loves this one. And one more. Very good. Now, I told her that I wouldn't do this to her today, but there are 2 points right below the clavicles that if you push in and rub in a clockwise manner, you will actually feel that those are very sore, but that will help the patient with their sinuses as well. Now, we've adjusted her on the y-axis and treated her sinus area at C2, also at C1, C3, decompressing those, taking the pressure off the nerves. Now I'm going to have her turn sideways, and let's come over and lay on your tummy on this table. First of all, can you breathe a little easier through your nose right now?
Yes.
Imagine that. Good. Okay. Now, this upper thoracic area in her cervical spine still, especially from T1 through T4, supplies the heart and the lungs, as well as regulates the autoimmune system. So we get a lot of interaction through the autonomic nervous system. So I'm going to let her head down a little bit more to stretch those joints out. And she's got trigger points in her trapezius muscles, worse on the left today. Her levator scapula muscles right here that go from her cervical spine down to her shoulder blade or scapula. And then you start getting into the rhomboids here. And I know those are sore, aren't they? Yeah, that left one's a lot worse. See, she's got a rib out right here too. Now, I'm going to do a thumb move right here where I'm going to contact T1 and T2. Okay, just let this go in my hand. There we go. Now, Same over here, just let this go in my hand. Okay. She's got a lot of very hypertonic musculature up there. Excellent. And you got to catch them between bucks on these things, because when they're this far out, and you can probably hear these all the way over there. Excellent. Now, she's also had some acid reflux and heartburn lately too, but now right here we're at T11 and 12. This area supplies the adrenal glands. Everybody that has sinus problems and allergies always are blowing their adrenal glands. So, and this is right where the thoracic spine meets the lumbar spine. So it's a change in a kyphosis to a lordosis here. And as you can see, actually her right side's a lot higher. And I bet that's tender right there, isn't it? Yep.
Very tender, ow.
Very tender, ow. Yeah. Take it easy, okay?
Okay.
Deep breath. No, I was telling myself that. I'm going to take it easy for you. See, she's got, her adrenals are blown too. This will cause you to have like a hyperactivity, and then you'll kind of crash from it. And it affects your sleep, everything. So when your adrenals aren't working properly, there we go, nice and easy. And we got one more just right here. Okay, now, I'm going to adjust her sacroiliac joints, left and right, as well as her sacrum, straight S to I, superior to inferior, bilaterally. And then I'm going to drop L5 straight down in the Z-axis, L4 straight down in the Z-axis, L3, and there's L2. Now I'm doing a lateral and oblique stretch here because she's got still super hypertonic musculature paraspinally from her thoracolumbar spine, which is where her mid-back meets her lower back. Now if you can see that, that's a lot more even through there. And checking on her suboccipital muscles, she's going to have tender suboccipital muscles right there on the right. This is also related to the sinuses. Very good. And then C2, of course, you get the paraspinal muscle hypertonicity there. And these are trigger point areas that affect the sinuses as well. So we're going to stimulate those. Okay, very good. Now let's have you sit up and face towards Renee. There we go. Good. She does a good job getting up and down. Now I'm going to check her shoulder. Lift your chin up for me. Look straight ahead. Excellent. Very good. Now look straight ahead. That's it. Right shoulder was not too bad. No grinding in your left shoulder either. So your shoulders and upper thoracic spine are now lined up better, so they're not even popping and grinding like they used to. Now you can even still see a little bit of the redness where I put pressure on that. But breathe through your nose right now. How much better would you say that is compared to...
I don't have any stuffiness.
No stuffiness. That's great.
I don't have any stuffiness.
So we don't have any stuffiness in this office either. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.